Hello, my name is Professor Andreas Birkenfeld. I am working in Tübingen in Germany, and I am the head of the Department of Diabetology and Endocrinology, and I'm also one of the speakers of the German Center for Diabetes Research. So adipose tissue plays a very important role in glucose metabolism. So first of all, it takes up a lot of glucose, and when we have more adipose tissue, more glucose is taken up. And there's another function in glucose metabolism, and that is lipolysis. So the release of fatty acids can be used in the liver, for example, to directly produce glucose. Another point is that the adipose tissue in obesity can get inflamed, and this inflammation can induce insulin resistance. So I think that adipose tissue plays a much greater role in glucose metabolism as we have previously thought. Of course, so we did research on this, and what we use is fat tissue directly from the pancreas of people. Then we can treat them with GLP-1 agonists or GIP or both combined. And what we can see is that the GIP receptor agonists, they can induce lipolysis. And that is important because these fat tissue, these adipocytes and organoids, they are within the pancreas and are in the direct contact with beta cells. And we know that fatty acids can induce insulin secretion on the one hand. And what we've shown previously is that in people that are healthy, this leads really to an improvement in insulin secretion, while in people that have a genetic predisposition or are pre-diabetic, it rather impairs beta cell function. And so it is an important point that needs to be considered when we treat people with GLP-1 and GIP receptor agonists. Yes, of course. So of course here at the EASD meeting there was the new guideline from the EASD, but also from other liver organizations on MASLD, which was presented. And there are some changes, for example, how we screen for MASLD and how we treat MASLD, because there are new treatments in the pipeline or even approved. So there is, I think, a big change in how we treat patients with MASLD. What we have analyzed, in addition, is the question, what contributes more to metabolic disease? Is it the fatty liver or is it the visceral adipose tissue? And research so far clearly indicated that it seems the liver fat in the liver is much more decisive on insulin resistance, and it seems to be the liver fat. Now this research all comes from cross-sectional studies, so at one time point. And what we have done in more than 2,000 patients, we've looked at the same question longitudinally. So for several years, we looked how does the change in liver fat or in visceral fat associate with insulin resistance and type 2 diabetes. And very surprisingly for us, so it was not what we suspected, but very surprisingly, it was the visceral adipose tissue that was much more associated, closely associated with the development of type 2 diabetes than hepatic fat. So I think there is more to research on, and it looks a little bit like visceral adipose tissue plays a greater role in the development of type 2 diabetes than we previously thought. Thank you. So pre-diabetes remission is indeed a new concept that we developed. It comes from the fact that regression to normal glucose regulation in patients with pre-diabetes has previously been shown to be protective from the development of type 2 diabetes. Now, we have done research and have defined pre-diabetes remission in a new way. And we have defined it by saying a person with prediabetes needs to go to normal glucose regulation, so fasting glucose of below 5.6 millimoles per liter, then in addition to normal 2-hour glucose in the OGTT, which is below 7.8 millimoles per liter, and has to have a normal HbA1c, which is below 5.7%. All the three parameters need to be normal. And in a big study, we have then analyzed if this is better to protect from the development of type 2 diabetes than just the standard care. And the standard care now, these days, is 7% of weight loss. So if we really read the ADA standards of care, it says that people with prediabetes and overweight or obesity should lose 7% of body weight. That's the standard treatment. And so we compared whether or not, if people lose 7% of body weight or have 7% of body weight loss and go in remission, what I just described, they are better protected from the development of type 2 diabetes. And indeed, what we found was that there was a 76% relative reduction. So 3 out of 4 diabetes cases could be prevented when we treated patients in a way that they went into remission. So we really think that prediabetes remission is a way of better preventing type 2 diabetes worldwide. And to finalize this is very important because, as you know, the numbers are predicted of type 2 diabetes are predicted to rise to 1.5 billion in the world in the year 2050. So we really need better prevention strategies, and we think prediabetes remission is very potent to reduce type 2 diabetes incidence.